Did you know that in 2024, over 42,000 women are estimated to die from breast cancer in the United States, with Black women dying at about a 40% higher rate than white women? That's according to the American Cancer Society. I sat down with breast surgical oncologist Dr. Shonda Grisby to talk about these numbers.
Early screening is the best weapon that we have to fight against breast cancer.
According to the Breast Cancer Research Foundation, breast cancer is the most common cancer and the leading cause of cancer death in women, especially Black women.
Essentially, I think it's just community, trust in physicians, trust in the people that you have around you. Some socioeconomics also play a part, access.
And while statistics show a 42% decline in breast cancer deaths over the last 3 decades, the persistent mortality gap is alarming.
We eat a lot of bad foods, and I also understand that there's the socioeconomics behind that, as we talked about before. Food fear, access to healthy foods, right? So we know there's some things that we have to work on as a community and as a society.
And access to health care is another hurdle.
People who don't have the transportation to get to where they need to, or transportation to go to their chemo or radiation therapy, or the finances to even be able to pay for the medication.
Another factor, fear of asking questions.
I think that is one big factor of not knowing what to ask, not knowing how to express a symptom or a concern in a certain way that makes a physician or a clinician understand it.
Nora says speak with others who have sat across from a doctor and heard those words. You have breast cancer.
I need to speak to someone who's been there. And what did you do when it was this hurdle? And what did you do when it was that hurdle? And, you know, we need somebody that's going to walk alongside us.
Grisby agrees. A support system is a game changer in this battle. And she tells me work is being done to bridge the gap, but community help is needed, like more African Americans participating in clinical trials.
We do know there's, different risk factors for those that are of African descent. But we need more to understand what the population is going to see based off of that information.
She tells me genetics also play a role, but one local family with zero family history of breast cancer says their 27-year-old daughter's 3-year battle with stage 3 triple-negative breast cancer came as a shock. Her mother is sharing her story with me on Wednesday to raise awareness.